There is nothing worse than not getting enough sleep. Waking up in the middle of the night, tossing and turning, trying to figure out a comfortable position for your body. When it comes to comfort in the bed, we all have had instances where we've waken up with a stiff neck, painful shoulder, and achy lower back. So today I'm going to cover the worst and the best sleeping positions to ensure you get adequate sleep and a restful night. Let's get started. If this is your first time here, my name is Dr. Mike, and I'm a physical therapist who created this channel to help educate people like you on how intentional movement can improve your health. Today, we are going to talk about how important alignment and support is for your body. We must consider the amount of time we are spending lying down at night. Whether you're getting 4 hours of sleep or 8 hours of sleep, either way, we are spending long hours of the night in one position. This is why how you sleep is important. Now, some of this is habitual, but even the smallest changes can make a whole lot of difference in helping you not wake up with nagging, aching pain. As we break down each sleeping position, we are going to show you how it affects your neck, your shoulders, and your lower back, especially since these are the most problematic areas. Let's start with the first and the worst position for you. This is sleeping on your stomach. When someone is lying on their stomach, in order to breathe, they have to turn their head either to the left or to the right. Unfortunately, when we do this, our neck is placed at end range rotation, which overstretches one side but shortens the muscles on the other side of the neck. As a result, can lead to achy, stubborn neck pain that can last for days. Imagine sitting with your head rotated for 5 to 8 hours a day. Not gonna feel good. As for the shoulders, if you sleep on your stomach, you probably also place your forearms underneath your pillow, whether it's in hope to provide more support or it's just simply a habit. However, this places both shoulders in end range internal rotation, which increases the likelihood of shoulder impingement and overstretching the nerves of the shoulder, causing numbness or tingling in the arms. As we take a look at your lower back, we can tell that because of the size and the structure of the rib cage, gravity and our stomach sinking into the bed, we can see that lying this way causes our lower back to hyperextend with increased lumbar lordosis. This causes your pelvis to roll forward, causing increased shearing on the lumbar spine. Now, if you're a stomach sleeper, you probably also flex or bend one hip up towards the side, which you can also see that it creates a slight rotation in the lower spine. It's not really an issue when we stay there for short periods of time, but when we are in these positions for long hours of the night, this is when we tend to see muscles, nerves, and tissue aggravated. Now we will move on to a better position, which is sleeping on your side. The most common issue we run into with this posture is people either using a pillow with too much cushion or a pillow with too little support for their neck. Everybody is going to require various support due to the variability of the width of our shoulders. Some people with wider shoulders may require more cushion, versus someone with a more narrow shoulder frame may require less. When you lay down on your side, the goal is to have a nice, neutral alignment for your neck. With the shoulder, we can tell that if I lack the amount of support in my neck, it causes the weight of my upper body to lay straight on that shoulder, which typically will lead to the shoulder being pushed and rounded forward, leading to more shoulder pain. To avoid this, you can support your neck up higher so that it takes some of the weight from your upper body off that shoulder you're lying on. As for the shoulder that's on top, you can also support your shoulder and allow it to be stacked with proper alignment by simply placing a pillow in front, similar as if you're hugging this pillow. When we're lying on our side, with our lower back, we also see that people tend to have one leg swing over the other, causing some rotation and some shear at the lower spine, which can irritate those intervertebral discs. Best way we can help with this is by placing a small pillow in between your legs to help stack your knees and hips, creating good alignment at the pelvis. And this really doesn't have to be a large one. So before we move on to the best position, I have a question for you. What is your favorite sleeping position? Please leave a comment below. Now let's move on to the moment you've been waiting for. The most ergonomic position and best position for you to sleep in is sleeping on your back. Now, even though this is the most posture-friendly position for your body, there are still ways that you can do this incorrectly. This is why your particular pillow and mattress does matter. Not enough support will cause the neck to extend like this. Too much support will cause too much flexion in the neck, kind of like when we have a forward head posture when we're sitting. One of the biggest mistakes I see people make is placing the pillow underneath their shoulders and their neck, causing a rounded upper back with your chin digging into your chest. To avoid this, try grabbing the corners of your pillow and pulling it snug so that the pillow hugs your neck. Or just simply get a pillow that allows your neck to be neutral. In regards to the lower back, people tend to have increased lordosis in the lower back since naturally your hips will sink into the bed, causing increased shearing in the spine. To avoid this, you can place pillows behind your knees, which will help you relax the lower back muscles and place your lumbar spine in a neutral position. If you suffer from any low back pain, this can be very helpful for you. There you have it, the worst and the best sleeping positions for. Now, if you're not doing any of these items that you learned today, I would highly recommend making small, subtle changes. If you try to just completely change your sleeping position overnight, it will not be comfortable and you will set yourself up for failure. The main point for today is that you become aware and you know what changes you need to make with your sleeping positions and what you can do now to prevent you from waking up with pain. Remember to train harder, not smarter. If you like videos like this, please make sure to hit that like button. This does help me on YouTube to support my channel. Also, to help support me, you can hit that subscribe button below to help continue to grow my channel. Go ahead and turn on notifications and you will never miss a video, and leave a comment below if there's topics that you would like to hear about. Until next time, see you in the next video.